For the others who is thinking about GP training, especially those people who from overseas international graduates, you are very welcome to Australian and definitely thinking about the rural GP trainings. You will have a great experience and you will love the countries here.
G'day there, Dr. Anthony Llewellyn, the Career Doctor. So today I've been invited to a General Practice Training Day with one of the local training providers for GP trainees. So I thought it would be a great idea for you to tag along and find out a little bit about General Practice Training. What you're going to discover is it's probably going to bust some of the myths that you have about General Practice Training. It's not about training and learning in a small general practice, maybe on your own with a few other GPs around you. It's a very modern, effective and very large group-based process. There's a lot of GP trainees here today, so let's find out a little bit more about it.
I'm a GP registrar from Inverell Medical Centre.
Hello, I'm Jamal Ghanem. I'm an overseas trained doctor who's been working in Australia since 2005.
I chose to have rural GP training because it gave me a different experience for the Australian. I grew up in the urban city, you never know what is the countryside look like and how the people access their health needs, and everything is different. So that's why I choose to go there and just to have some experience and see if maybe that's something I would like to do in the future.
I recently joined the Royal Australian College of General Practitioners training program with GP Synergy. I'm starting my new rotation in GP practice in Wyoming. Prior to that, I did 6 months emergency training. I'm very excited to start my GP practice.
Yeah, recently I've been working in Inverell Medical Centre. Inverell is not say small, and people are very nice. All the patients I really appreciate when I was there and asked me to stay longer because they really need doctors there.
I had a passion about knowing the health system and the way we can improve patient journey and health delivery. So I worked as a director of medical service in various public hospitals, and during that time, 10 or 15 years, I observed the gaps and the way we can improve patient journey and how we can deliver the health system in a most effective way. And I believe general practice and primary care plays a major role in this.
I'm here with Dr. Vanessa Moran. Hi Vanessa.
Hello.
So we're at one of the GP Synergy training days. Can you tell us a little bit about what's going on here today?
Yeah, Anthony, so today is the first day of term for our GP training registrars, and we've got 2 sets of registrars here, one that have just started their very first day of GP training, and another set that have already been doing their GP training for 6 months. So really great to have our GP trainees here today. So we've got about 15 trainees on their first day, and today we're doing really an orientation session. So learning about your GP training, meeting your peers, meeting who your medical educators will be and who your training coordinators are looking after you during training. And then our registrars that are returning after doing 6 months of training are having some further upskilling, so some more extensions to a lot of the education they've already had. So for example, they're getting some reminders about doctors' health and wellbeing, and they're doing some additional training in some clinical topics like anxiety and depression. We do have 18 days of training throughout the whole year, and depending on where you are, it's on average about 1 day a month during that year, with a couple of big online days as well.
Today we are actually in GP Synergy to have a framework. So everyone from here, from GPT-1 who's new started, or some GPT-2 and 3s. So we are here to meet each other and learn something. I found it is quite different to be a rural GP because rural GPs actually need to do more than urban doctors, because the access to the specialist, to the hospital is limited, and so you have to have a broader knowledge to help your patient to initiate the investigations and do a lot of things by yourself.
And the main interest with it is just continuity of care, just looking after the patient and just walking through their journey of health rather than just managing acute issues.
The thing I like about the GP training is I get a very systematic education about all aspects of GPs, and I've got great support from the supervisors and medical educators, and everyone's helped me to prepare for my college examination as well.
And the GP training exams are pretty tough exams like any other specialty. And the best thing I love about the GP exams is that they really are about general practice. So the more experience you have in general practice, we know the more likely registrars will pass. So that's one of the big things that we support, is that making sure registrars see the full curriculum through their GP terms. And as well as that, we do have online exam support through our learning management system, and we run lots of mock exams as well.
As an international medical graduate, I actually have to pass my AMC examinations, both Part 1 and Part 2, before I can get my registration in Australia, and then complete my hospital rotation for all necessary elements, then to start my GP training. But I think it was the time and the effort to do it.
I mean, as long as you pass your AMC exams, Part 1 and Part 2, you are able to apply for training program. The only difference is can you go through a general pathway or rural pathway? And in fact, there is not much difference, and just the rural pathway probably provides more opportunities. By preparing appropriately, there is no reason why you won't be accepted.
The support I get from the GP training is, as mentioned, not only from the medical educator, the supervisor in the practice. They are the main person to support me throughout the day with all the cases I need to discuss and all the skills I need to gain to be a GP. And also the training organization like GP Synergy give me a very good support from all aspects. It's not only from moving practice to practice, also getting to the knowledge of everything and to get familiarized with the local environment.
Although it's an early stage, but from day one when you join the program, you can see the ongoing support. They've got, first of all, just their platform is amazing, so because the access to information is very, very good, and everything is readily and accessible and very nicely explained.
So what other supports outside the training days are available for GP trainees?
Yeah, look, it's a really good question. So I talk about GP training as there's about 5 to 10% is the education we provide here at GP Synergy. So coming in for GP training days, then probably 30 to 40% of your education support is in the practice with your supervisor. So your supervisor in early training has 3 hours of dedicated education with you. So an hour of like a proper teaching session and then a couple of hours of case discussion. So that's every week. And then as you graduate to being more competent and more confident, that does tailor off a little bit. But the majority of that education is in the practice. Then the rest of that percentage there is your self-directed learning, and that's really about what you might need as an individual, because that looks different for everybody. So we have a really rigorous accreditation and education program for our supervisors, where you can't just be any old GP to be a supervisor. You do need to be accredited and specially trained. And then as well, we do support through peer support as well as through continuing professional development.
In terms of communication, and the support from the GP Synergy is great as well. And on top of that, you've got the medical educator who are accessible via emails. The support is there, and the feedback I had from the other previous candidates and registrars is very, very, very positive.
Great.
Our rural communities absolutely love having GP trainees. So it's one of those really special experiences for a registrar, and often our registrars stay in a community longer than they expect because the town just looks after them so well. So you've got that real community support, you've got the local supervisor and practice support. We've also got rural support officers that provide pastoral support. We've got a rural programs team that help you with any additional supports you might need in terms of procedural skills, upskilling, or perhaps using those procedural skills in town. And we also have financial subsidies for our rural registrars as well.
Yeah, so I actually got the grant for the Inverell area last term, 10,000 grant for the 6 months stay to stay in Inverell, so which is a very good and very useful money because it covers us for the move from the urban to the rural area. It also covers us all the rental cost over there, and we can also have some spare money to visit the local area and have some exploration like we did with our other registrars who had house riding. We went to different towns, had morning teas and lunches, and had some campings over there, so it's a fun time.
Now, international medical graduates, if they want to do GP training, will have to do rural training. Do you have any specific supports for IMG doctors, particularly early on in their careers?
I think for our IMGs, we absolutely value what services they provide for us and actually what wealth of experience they bring with them as well. So we really look at our international medical graduates as individuals and provide them with support that they might need. And it really does depend on their experience. They may already be a GP in the country that they're coming from, or perhaps they're from another specialty or at the beginning of their training. So we would look at what they might need from their clinical experience and provide additional support in that way. We might also look at what they might need from a language support, so they might need some additional help with understanding English context or Australian context. Again, they might need Aboriginal and Torres Strait Islander cultural support, and we have a cultural support unit to help with that. And then I think about things like pastoral support and relocating to a new community, and again our rural support officers can even help support families, things like introducing to schools and perhaps connecting with local councils to get jobs for spouses and things like that. Our rural communities really need generalists, but they also need generalists with additional skills like anaesthetics and emergency. So you can actually get what we call an advanced skill qualification, and one of those examples would be in anaesthetics, and it's an advanced skill for an extra year. So you do your usual general practice training and then an extra year of advanced skills, and it means that you can be a GP but also provide anaesthetics, and in a small country town as well. So we would absolutely love to have somebody with some additional skills. It doesn't just have to be emergency or anaesthetics, it can also be things like paediatrics, palliative care, mental health, lots of options. We'd love to talk to you about that. So I would definitely suggest checking out our GP Synergy website, so gpsynergy.com.au, and there's a section there on GP training through the Australian General Practice Training Program. We've got lots of information there about how you might apply, what sort of experience you might need, if you've got a visa requirement, what sort of visas are accepted, and what you might need to do to prepare as well.
For the others who is thinking about GP training, especially those people who from overseas international graduates, you are very welcome to Australia, and definitely thinking about the rural GP trainings. You will have a great experience and you will love the countries here.
I encourage them just to apply, and just it's a privilege to serve our community. It's a great training program, and I believe that we are in need of more GPs.
Great, thank you very much for having me today, Vanessa.
No worries, thanks for having me.
Thank you very much. Thank you. Thank you very much.
All right, no worries.
Thank you. Put some money back into the local economy.
Yes.
Yeah, it's a great education for GP trainees. It's a really sort of supported environment. Our medical educators are all GPs with a special interest in medical education, so they just love getting everybody together in a room and sharing knowledge, talking about cases, and yeah, really just supporting the GP trainees.